My name is Nathaniel Jensen. I am an optometrist and I teach pediatrics and binocular vision. UV protection blocks the damaging rays from the sun that have been shown to cause damage to some of the tissues in your eyes. So wearing UV protection like sunglasses helps, especially over the long term. We are just exposed to more UV rays at this elevation compared to other places. In a lot of ways, it kind of doubles the amount of exposure you're getting. So you're getting from the sun itself, but then it's also reflecting off, from below as well. The biggest thing would be wearing sunglasses, and there are some contact lenses that have UV protection. I think most of them do now. That kind of depends who you ask. As far as I'm aware, there hasn't been like a definitive scientific yes, this is proven to prevent problems, but some people use them and really like them. It makes them feel more comfortable and helps their eyes, and other people have tried them and haven't noticed a difference. So I'm kind of happy to say, hey, go ahead and try it. If the biggest emitter of blue light for us is actually the sun. The one thing that it does do is tell your brain to wake up, right? So if we're using screens late into the night, we may have problems sleeping, but that is not necessarily harming our eyes. A good tip on really eye strain and kind of focusing, right? Because our screens are really close. There's a rule that's called the 20-20-20 rule. So every 20 minutes you look at least 20 feet away for at least 20 seconds, and that's a way to alleviate eye strain and help. And I like this. They'll add another 20 on the end, which would be do 20 eye movements, right? So look over there and pick something off in the periphery, move your eyes to it. Pick something off in the periphery, move your eyes. Do that 20 times. That kind of helps relax things and get a lot of your visual function running. I think so. I mean, I think they're already very common, and many of them are probably just undiagnosed. People are just dealing with it and they don't realize maybe there's some help that we can give them, or maybe they don't want glasses and so they're avoiding. That's just part of life now. We're all on screens. You have to be for work and school and everything else. I'd say usually that's the biggest cause of eye strain, because our visual system is built to be focused for far away, so our eyes are having to get used to looking up close and straining for all that focusing. Managing your working distance as well. So if you're on your phone, we really don't want it really close to our face. So from your knuckle to your elbow that's a good estimate of the closest you would want to hold something that you're reading or looking at, or further out to avoid strain. Typically every year, because children are growing and things are changing so much every year, just a good time frame is beginning of the school year or something, just to make sure everything's ready to go. But yeah, usually we'd recommend once a year so we catch any changes. School vision screenings are great because they can catch any huge red flags, but they are not a comprehensive eye exam. So while they do good, and we're happy when someone's had a vision screening, they really should come in for a comprehensive exam, get their eyes dilated so we can rule out all of the problems. It's recommended that kids get eye exams starting at 6 months of age. And the idea there is just to make sure that everything's developing properly so that as they grow, their vision is functioning optimally. I think the biggest thing is glasses that they're gonna wear. So if the kid likes it, they're more likely to actually wear it. It's gotta fit properly, right? You can't put an adult frame on a child, but it needs to fit, and the kid needs to wanna wear it. My favorite thing about optometry is I work with kids, and I like seeing lives change and being able to help kids that are struggling and take them from where they are and bring them to a place where they're not struggling so much, and all of a sudden they're successful and willing to try new things, and that to me is awesome. Both. You can see I'm wearing glasses right now, so I like both. I lately have just been wearing glasses because it's easier to just grab them and run, so that's often what I do, but I have contact lenses at home. Eye vision tips. Get up and get moving, move your body, get outside, you know, look far away,